I would just like to cite my sources. Did you know that heart disease, stroke, and diabetes are some of the preventable diseases caused by obesity, and that you can greatly reduce your risk of getting these diseases by living a healthy lifestyle? It's estimated that in the year 2030, $48 to $66 billion will be spent on obesity-related diseases, and this will mostly be paid by American taxpayers. So whether or not you're obese, obesity affects you. According to the CDC, 42.4% of Americans were obese in the year 2017, and this number's been on the rise. Last May, I had weight loss surgery, and I couldn't be happier with my decision to do so. There are multiple surgical options for weight loss. I chose the gastric sleeve. The gastric sleeve is actually a partial gastrectomy, gastro meaning stomach, ectomy meaning removal. So this has reduced the amount of food I can physically put in my body, and has also taught me how to better give my body the nutrients it needs, because I can't be eating anything I want all the time. There's only so much room and so many hours in the day. The main reason that I chose this surgery was because the part of the stomach that is removed is the part that has the hunger hormone, and I'm no longer fighting the internal need to feed, which was 90% of the battle. The other 10% was ice cream is very yummy. Like, there's no denying that. But I knew better than to eat out of convenience and boredom. I wasn't raised that way. But as far back as I can remember, I had an insatiable hunger. And the pangs, they'd make me sick. The prehistoric urge to fill my belly won every time. I was almost 40, and I had been crash dieting since puberty. This is a picture from December. I had my surgery in May, and this is the December before I gained those 8 pounds. We'll get there. Anyways, my weight had never slowed me down as a young adult. But I was starting to feel the aches and pains of aging, and I was pre-diabetic. So I decided to talk to my doctor about options for weight loss. And we spent the next few years trying different approaches, pills, therapy, but they just didn't work for me. After all the research and tears, I finally made up my mind on weight loss surgery. My insurance would pay for $2,000 of the $25,000 surgery, as long as I was at a 40% BMI, body mass index, which is the amount of, like, I had to be 40% of my weight had to be fat. It's kind of gross. But lucky for me, I was the heaviest I had been in my life, and I was only 8 pounds away. After I was heavy enough, we started the clinician visits, dietitian visits, and monthly small weight loss goals, just to make sure that, you know, I was able to lose weight. The surgery took 1 hour, and it was done laparoscopically. They put 4 holes in, and the only scars that I have left are, well, it's just one of them, and it's about 2 centimeters long and pale pink. And I have stretch marks from being fat that are worse than the scar from the surgery. I don't remember feeling a lot of pain in the hospital, or even after I came home in my weeks of recovery. Actually, besides not having an appetite, I felt 100% like myself maybe a week later, but I still took I took 6 weeks off, but went back early because I was bored. Being a nurse, it's very physical. If I had a desk job, I probably could have gone back after a week. But even though I felt fine. I know that what was the 20% that was left in my stomach was being held together by staples. So I had to, I couldn't go back right away. But the first week of my diet consisted of clear liquids like broths, Gatorades. I also had to crush my medications. Tylenol was for pain just the first week, and then I took Senna for a month or two. I can't remember for sure, and that was so I didn't get a bowel obstruction. Senna helps you poop. The second week, I advanced to a full liquid diet, which included things like yogurt and hot cereal and protein drinks. Week 3, I moved to a pureed diet. Week 4, I was able to start introducing new foods into my diet. I chewed everything to applesauce consistency like I had been taught. And I had to start with soft foods and increase the texture and flavor slowly, one food at a time. And I've been adding different foods ever since, one food at a time. While talking about complications of bariatric surgery, ClevelandClinic.org says that nearly 30% of patients who have weight loss surgery develop nutritional deficiencies such as anemia, osteoporosis, metabolic bone disease. And these deficiencies can be avoided if vitamin and mineral intakes are maintained. 6 months after the surgery, my hair started falling out, to the point where our drains plugged and we needed a plumber. Luckily for me, I have enough hair for 2, possibly 3 heads. And I was doing everything right. My doctor said I didn't have a deficiency, but that the extreme weight loss is in such a small amount of time is probably the shock that caused my hair to fall out, along with the spotting that I had, cervical spotting, because, I don't know, the stress. I'd get random periods here and there, which I never experienced before in my life. She said my hair would return because I was taking good care of my nutritional needs and I didn't have a chronic illness or genetic reason for hair thinning. My hair ended up growing back as fast as it fell out. So the hair loss was one negative thing, and I gave myself dumping syndrome at work once. That was embarrassing. Oh, it would be impossible for me to compile a list of all the positive things to come out of my choice to get weight loss surgery. The health benefits alone are worth it. Here's a picture of me the December after. So I had surgery in May. Here's me, June, July, August, September, October, 7 months after, 5 months before. Side by side. Anyways, as of today, I'm down 80 pounds, but I had to take 2 months off work for my leg went numb, so I wasn't able to exercise or work, and then I didn't lose any weight. And since I've been back to work this past couple weeks, 3 weeks, I've already lost almost 10 pounds. That just, that's hard. My job's hard, but Well, one of the great things from the surgery is that I could not have regular sugar and fats or carbonation for so many months that I lost the craving for soda and other unhealthy foods. I'm the healthiest I've ever been in my life. I have more energy throughout the day. I guess you could say weight loss surgery was life-changing. Not in the sense that my life took a different path, but that I'm just living a better life. Living my life better, if that makes any sense. I still have to diet and exercise to keep the weight off, but I got the jump start that I needed to feel motivated. A friend asked me if I'd do it again, and my response was, I wished I would have done it 20 years sooner. But please remember, this is my personal experience with weight loss surgery, and if it is something that you are thinking about, you need to speak in depth with your doctor, and you need to read multiple testimonials or view on video, not just mine. I feel like I'm one of the lucky ones. Thank you.